Welcome to the Atlanta Technical College Dental Hygiene Program Information Session. Why are you here today? Most people come to information sessions and seek out this career for a better family life, job security, the love of dentistry, or were you a dental assistant before and you want to advance your career? All of those things are possible, so we're glad that you are here. Let me show you the reason why I chose dental hygiene.
One heartwarming experience that I had teaching here at Atlanta Tech was actually giving a patient the opportunity to see their teeth for the first time. All of their teeth were covered with what we call dental calculus. The patient didn't have any self-confidence. After we cleaned their teeth, we gave her a mirror. She cried. I cried. She just hugged us because she was so grateful for what we have given her.
This is what you need to know about the profession of dental hygiene. Is this profession right for you? Dental hygienists are extremely high when it comes to ethical behavior. The essential skills and abilities that are required for the dental hygienist are those who do not suffer with nerve or muscle disorders, visual impairment, severe cognitive critical thinking ability, cannot sit for long hours, very fearful of blood or needles. But other requirements, especially for the Georgia State Board of Dentistry, may not give a license to someone who holds a felony. And those who do not like to work independently at all or as a team player, the dental hygiene profession is not for you. The importance of the dental hygiene profession. All three of these things that you see here is what we actively do every day. We not only educate the patients, but we prevent disease from occurring. But if there is oral diseases, the dental hygienist is the one who treats it. These are all the do's and the don'ts of a dental hygienist. So let's talk about the don'ts. All right, so first off, a dental hygienist is not a dental assistant or the dentist. Okay, we fall kind of in the middle. So the dentist is the one that diagnoses the disease and treat the disease. The dentist is the one that's going to put a filling or a restorative on a tooth, like crowns, fillings, bridges, partials. We don't do those things. The orthodontist is the one who puts braces on, and etc. So these are all of the things that dental professionals, such as the dentist, will do, not the hygienist. We're the ones who the patient will see for x-rays, the treatment of gingivitis, the treatment of periodontitis. We will do the location of any kind of cavities. We perform oral cancer screenings. We can bleach your teeth. We do a lot of things to provide the foundation of your whole oral health. Now let's look at some career options. If you are interested in becoming what we call a clinician, that means that you will work directly in a dental office, chairside dentistry. With your associate's degree, you can accomplish this, and that's exactly what we provide. If you're interested in doing what we call corporate dentistry, that is working for sales, product researcher, corporate industries, such as Colgate or Oral-B or GlaxoSmithKline, Sensodyne, Listerine. You could go work with your degree in these areas. Public health is one of my favorites. I hold my public health master's degree. Public health means that you look at the population as a whole, not just specifically at one particular patient. So for example, if I wanted to increase oral health in the state of Georgia, I could go work for the CDC, Head Start programs, or local health departments to initiate education initiatives or actually fluoride treatments to improve the public health as a whole. A researcher is someone who could go work for government agencies, nonprofit organizations, those that do more of the qualitative versus quantitative data and analysis. And of course, my favorite is the educator. I love being an educator, a teacher, helping you obtain new career options. One of the things about the entrepreneur that I want to highlight is in other states, probably not Georgia, or I should say soon to be Georgia. In other states, you can actually own your own dental offices and hire the dentist to work for you. Different laws are under different states. In other states, as a dental hygienist, you can further your education to go and do simple fillings and restorations. You could give anesthesia. You can become what we call a dental therapist. For example, you have the doctor and you have a nurse, and then in the middle, you have a PA. So a dental therapist is like a PA. They do a little bit more than a dental hygienist. They do a little less than a doctor, but they can diagnose and treat accordingly. What you should know: is dental hygiene perfect for you? Ethics in dentistry, again, is very important. There will be a lot of times where you have to make the final decision on what to do, how to treat the patient. So we always rely on our code of ethics and conduct. As we were discussing before about the motion and ability that's required for a dental hygienist, as you can see here in the figure, all of these highlight the areas that we commonly have injuries due to repetitive motion in the head, neck, shoulder, and arm area. Please take a moment to look up the licensure and the state that you want to currently in. Every state is different. But, however, you must graduate from a dental hygiene program. You must take a written national board exam. This is approximately anywhere from 4 hours to 6 hours long in length. And you must successfully complete a state or clinical board. So that means that you bring a patient, you clean their teeth, and they grade you accordingly to make sure that you are clinically capable to become a hygienist. You can take a picture of this screen. These are the Board of Dentistry rules and regulations on who can have a license and who cannot. So please make sure you do your due diligence before pursuing this career option. In the program, as a student, you'll be required to treat all types of patients. Our students see pediatric patients, adolescent patients, adult, geriatric, and those with any kind of special needs and concerns. Let's talk about the uniform. So our students wear Pacific uniforms that are program approved, which are most likely scrubs. And when it comes to PPE, we wear our mask, most likely 2 or 3 masks, a face shield, eye protective wear. We are covered from head to toe when it comes to PPE and uniforms. We protect ourselves, especially in this COVID situation, but we're pretty used to wearing a high level of PPE accordingly. Very high standards of infection control. Dental hygienists do not wear false nails or colored nails. They remain short and kept. Our hair for our students should be colored in a natural human colors. So that does not include greens, blues, severe whites, things to that nature. Tattoos remain covered at all times during lab. And if you decide to have facial hair, it should be short, trimmed, and also covered up during patient treatment. Your hair is off your shoulders and tied back at all times, or even covered with a bonnet. Why do we do this? It's because with the dental hygiene profession, we come in contact with bloodborne pathogens and other potential infectious material constantly, every day. And you can see the list of diseases here that are of higher concern. However, we have the highest PPE and infection control standards to prevent transmission. This includes immunizations. For the dental hygiene student, immunizations for hepatitis B is required. Now let's discuss some program specifics. The dental hygiene requirements require a 3.0 or higher GPA. So the application committee will take your English, your math, your sciences, and all the prerequisites that are required for the program and calculate your final GPA. There is an entrance examination that is required to take. Now, this is different from the campus admissions exam. So the program entrance exam as of September 2022 will be the TEAS exam, And the Campus Testing Center offers the TEAS exam that you can take. The required score is a 65% or higher to be considered. We will talk more about the application later. Other considerations is the background check that we discussed earlier. Negative drug testing is required, and we do various drug testings for all sorts of drugs throughout the program. All students are CPR certified. They will have to be medically cleared by a physician to participate in dental lab. Vaccinations are required for healthcare professionals such as dental hygienists, which is the hepatitis B vaccinations. So with hepatitis B, it is a 3-series immunizations, 3 series. And after those 3 series, you will have a titer, which means the doctor will pull your blood to test to make sure that you are immune to hepatitis B. Other vaccinations that are required come from our off-campus rotation sites. So students during a certain time in their education will go be the dental hygienist and work for that office as the clinician. So they require immunizations such as influenza and COVID. Let's talk about courses. So these are the listed courses that are required for all dental hygienist students. Your English, your Introduction to Computers, Public Speaking, Psychology, Sociology, Humanities, or Art, Music Appreciation can be credited, College Algebra, or Math Modeling. All of these courses here that you see listed in white do not have an expiration date. However, your science courses, your A&P 1, 2, chemistry, and microbiology, with the lecture plus the labs, do have an expiration date within 5 years. All of these courses that you see listed must have a B or higher to be considered. If you do make a C, that C is calculated in that final GPA average, but it is also unacceptable for the prerequisite course. The time commitment is a really big ordeal when considering to pursue this program. We do not have online classes. The program, it is face-to-face. It is a full-time schedule. So certain days are different. Monday through Friday, it is the time commitment. So certain days you'll be here till 5:30, and other days it may be change. When it comes to studying, if you're taking 3 classes, 4 classes, 5 classes, sometimes 6 in the dental hygiene program, we require 1 hour per week to devote it an integral part in studying. Now let's talk about the cost. Here is a sample estimated cost. Overall, it is approximately over $13,000. Some of this can be covered, of course, with financial aid, but others, such as your board exams, your clinical exams, certain things will be out of pocket. Now, let's discuss the application process. First, all students must apply to Atlanta Technical College with the general admissions application. Now, once you are accepted, you will be given a student email address and also a student identification number or 900 number. Now you can take all of the required prerequisites. If you already have taken prerequisites at another college, please make sure that you request specifically for transfer credit. That way they can take your basic courses and make sure that they match with Atlanta Tech for credit. So once you are completed with the prerequisites or you're in your last semester, it is time to apply for the program. You will submit a separate competitive admission dental hygiene program online application. This application normally is found on our website. The application period takes place from February 1st to May 1st. You can submit it during that time. In the meantime, please sign up in the testing center and earn a 65% or higher score on the TEAS exam. Now, at the end of the application cycle, what comes next? Well, on May 1st, the application committee will go through all of the applicants to see if we will accept or deny. We get really good students every year, and we only can accept a limited number of students. Students even making A's and B's in the minimum requirements may also be denied because it is a competitive admission selection. We base everything most likely on your academic performance, and it's on a point scale. For example, as you see here, once we calculate your GPA, and remember, the selection review committee does calculate every attempt that you take for the courses that are required, and that can lower your GPA. So any of the GPAs can earn up to 40 points, all the way low as 5 points. For every A that you earn, we will give you 15 points on your application, 10 points for every B. Of course, we do not accept C's. Courses have to be retaken. But if you earn anything from a C or below, we will take away points. Now, the T score is 65% or higher is what we are looking for program consideration. And you can see the rubric score there. Now, once you submit your application and your T scores, the program director, myself, will send you a complete application. This involves letters of recommendation, observation hours is a list. You could volunteer at a dental office, not the one that you work at. And you can observe the dental hygienist just to make sure this is what you want to do in your career path. If you do 1 or 2 sites, we will give you 10 points. If you do 25 to 40 hours, we will give you 40 points in that category. Again, that part is not required. It's just a way to help you gain extra points. You also have a chance to gain up to 1 to 5 points if you are currently a dental assistant who has been working in the field and certified. Allow me to show you a sample online application. You will insert your email. It will discuss the selection process. It will discuss the TEAS examination, extra points that you can receive. It will tell you how to register for the TEAS exam in the ATC testing center. And you can look up online resources online to find study guides for the TEAS exam also. The application will ask for confirmation that you viewed this video for the information session. And you would just fill it out and upload a copy of your transcript along with your TEAS results. Now, as conclusion of this application, you will email me, Director Singleton, at msingleton@atlantatech.edu to request a dental hygiene complete application package. Now, in this documentation, it explains again about the volunteering hours, the dental assisting experiences. It gives you the specific pages that someone has to document the proof on. It goes over our objectives, the mission, the rules and regulations of our program, a specific schedule, the payment information, and a lot of questions that you may be considering. Now let's discuss some frequently asked program questions. Are prerequisite classes required before I apply? Yes. Which courses? Once listed on our information session, please visit the most updated website link. Am I allowed to take prerequisite courses and enter the program at the same time? No. The dental hygiene courses listed DHYG, as you see in Banner Web, are only restricted to dental students. Let's see. We offer evening courses. Our program runs from morning to evening hours, so from 8 a.m. to 5 p.m. What can disqualify me from being selected? I'm a transfer student. Will Atlanta Tech accept my college courses? Please visit the Office of Enrollment Services. They're the ones who will evaluate your transcript. Dental hygiene clinical instructors will not. Let's see. What will disqualify me from being selected in the program? Admission is based off of academic performance. So low GPA scores or repeating performances in classes could potentially lower your score drastically. Once you apply to the program, how am I selected? Again, we award points for GPA, course grades, and the T scores. You can earn extra points with volunteer hours or having dental assistant experience, but no seats are guaranteed in the program. Here are some pictures of our classroom. We do a lot of things inside the classroom, but also outside the classroom. You'll not only get didactic experience with knowledge, but you will also get outside hands-on clinical lab. I want to share a few success stories. The picture here, you will see some of our graduates of 2022 at the Georgia Aquarium. They were invited by Christian City Community Center. This organization, oh my gosh, is so heartwarming. They help not only children in need, but orphans. They help adults and even geriatrics. They get a chance to live on their property, and they provide everything that they need to be successful in life. It was amazing that our students volunteered to help their organization. Here you will find Ariel, the RDH. Miss Ariel Cornwall was a graduate who actually became a published author and a motivational speaker, all because she did an assignment in her senior year of the dental hygiene program. As she wrote a book to teach children, I encouraged her to get it published, and she did. Here is our 2022 Atlanta Technical College gold winner, Miss Tatiana Matthews. She placed 8th in the state of Georgia as one of the top students. Miss Matthews is such an encouragement not only to her classmates, but to in the entire campus. Miss Matthews, she was a dental assistant in the past, and she wanted to always extend her career to be a dental hygienist and clinician. So she fought so hard in life, despite all of her background and obstacles. And she made a beautiful example for her son who is on the autism spectrum. So we are so proud of Ms. Matthews. She got a chance not only to meet the commissioner, but talk to the mayor to express her concerns with technical education and the success that we can have. So she is paved in many pathways. Here in the middle, you should find Mr. Mustafa Kante and also Eureka Charles. These two individuals graduated in 2020, and they have traveled to Africa to actually provide free dental education and care to individuals who do not have the opportunity to do so. So many mission trips that they have organized together, it is growing and expanding. So graduates of Atlanta Tech not only are working in a dental office, but they are changing the world. So in conclusion, I would like to share one last video message with you.
Inside the classroom, you will always hear Ms. Singleton say, "Give me more." I always encourage my students to reach out beyond that textbook. Do that research. Give me more. We go far beyond the four corners of the textbook, so we try to incorporate the latest technology and we use innovative ideas.
We have superb instructors and they give you one-on-one time. And I love that about our instructors. You're not just a face in the crowd or a name on a paper. I feel like we actually mean something to them. And that's what's really important to me, because we can instill that within our personal selves and we can transfer that to our patients.
We see children, we see geriatric, we see special needs individuals, and especially those who do not have those health insurance benefits, we're able to treat them effectively.
It's so rewarding to provide care to someone who wouldn't have had it otherwise. Sometimes they come in so afraid to open their mouth because of the condition their mouth is in, and they leave my chair with their cheeks hurting because they're so happy and they're smiling too much.
One heartwarming experience that I had teaching here at Atlanta Tech was actually giving a patient the opportunity to see their teeth for the first time. The patient didn't have any self-confidence. After we cleaned their teeth, she sat up, we gave her a mirror, she cried, I cried, she just hugged us because she was so grateful for what we have given her. And these stories, that's the level of service that we have for the community, that we train our students to provide every day. You're not getting a job at Atlanta Technical College. When you graduate, you're developing your life, you're developing a career. My name is Marisha Singleton. I am the Program Director for Atlanta Technical College Dental Hygiene, and success starts here.
We thank you so much for viewing this information session. Hopefully it has fueled your passion for the profession, give you insight into our lives in the industry, and help you make a beautiful, informed decision about choosing the best career option, which is dental hygiene. Thank you again.